Imagine a child suffering from a simple ear infection, an illness that not long ago would have been easily cured with a short course of antibiotics. Now that same infection lingers, stubborn and unyielding, because the medicines we once relied on are losing their power. For this child, relief is out of reach, and the pain becomes a daily companion. Picture a young mother, her days overshadowed by relentless anxiety and depression. She struggles to care for her family, her energy sapped by an invisible weight. Mental health challenges like hers are becoming more common, affecting not just individuals, but entire families and communities. Consider a grandfather, bravely managing diabetes and heart disease. Every day is a battle, monitoring blood sugar, taking medications, and hoping for more time with loved ones. His story is echoed in millions of households around the world. These are not isolated incidents, they are snapshots of a silent pandemic engulfing our world. A crisis that rarely makes headlines but touches every generation, every community, and every walk of life. Beyond the headlines of COVID-19, a complex web of health threats is quietly weaving its way through our neighborhoods. Hospitals are stretched thin, communities are disrupted, and families are left to pick up the pieces as this hidden crisis leaves devastation in its wake. From the rise of antibiotic-resistant superbugs that threaten to make routine infections deadly, to the alarming surge in mental health issues that leave millions feeling isolated and hopeless, we are facing a global health crisis that demands our immediate attention and collective action. The numbers are stark and sobering. The World Health Organization warns that by 2050, antibiotic resistance alone could claim 10 million lives each year, surpassing the death toll of many major diseases we fear today. Meanwhile, mental health disorders, including depression, anxiety, and stress-related conditions, have become the leading cause of disability worldwide, affecting people of all ages and backgrounds, and straining already overburdened healthcare systems. The food we eat, often packed with sugar, salt, and unhealthy fats, is fueling a global epidemic of chronic diseases. Obesity, type 2 diabetes, and heart disease are on the rise, threatening to shorten lives and diminish quality of life for millions. This silent pandemic is all around us, demanding that we pay attention before it's too late. The statistics paint a grim picture. 1 in 6 people globally suffer from a mental health condition. Chronic diseases account for nearly 2/3 of all deaths worldwide. Antimicrobial resistance is rendering once treatable infections deadly again. These are not just numbers, they represent real people, real families facing unimaginable hardship. This crisis is not confined to one corner of the world, it stretches across continents, impacting both developed and developing nations. While anyone can be affected, the burden falls disproportionately on the most vulnerable. The weight of this health crisis is not evenly distributed. While the world faces a common threat, the burden falls heaviest on those who are already struggling to survive. In every corner of the globe, the most vulnerable populations are bearing the brunt of the crisis, often with little support or protection. It's a harsh reality that those who have the least often suffer the most. For families living in poverty, every day is a battle, not just against illness, but against hunger, insecurity, and uncertainty about the future. The crisis has only deepened these struggles, making it even harder for them to break free from the cycle of hardship. Impoverished communities, already grappling with limited access to basic healthcare, are hit hardest. In remote villages and urban slums alike, clinics are often underfunded and understaffed, with few supplies and little hope of meeting the overwhelming demand for care. Overcrowded living conditions, inadequate sanitation, and malnutrition exacerbate the risks. In these environments, diseases spread quickly, and children are especially vulnerable to the long-term effects of poor nutrition and unsafe water. Hospitals, already stretched thin, are struggling to cope with the influx of patients battling complex, chronic conditions. Medical staff are forced to make impossible choices, and many patients are left waiting for care that may never come. The healthcare system is buckling under the pressure, further widening the gap in health equity. Exhausted healthcare workers do their best, but resources are scarce, and the needs are immense. This is a crisis of inequality, where access to quality healthcare, nutritious food, and a healthy environment has become a luxury many cannot afford. The pandemic has exposed and intensified these disparities, reminding us that true recovery means addressing the root causes of inequality and ensuring that no one is left behind. This global health emergency is not a result of fate, it is a consequence of our choices. The rise of processed foods, overflowing with sugar, salt, and unhealthy fats, is directly linked to the surge in obesity, diabetes, and heart disease. The spread of health misinformation, often amplified by social media, is leading people astray, promoting unproven remedies and fueling vaccine hesitancy. The overuse of antibiotics, both in human and animal healthcare, is fueling the rise of drug-resistant superbugs. Environmental degradation, from air pollution to contaminated water, is taking a toll on our respiratory and cardiovascular health. The challenges we face today are immense, touching every aspect of our lives, but they are not insurmountable. Together we have the power to create meaningful change, no matter how overwhelming the obstacles may seem. The first step towards change is awareness. By understanding the issues at hand, we can begin to see the role each of us plays in shaping a healthier future. We must educate ourselves and others about the interconnectedness of these health threats, how our choices, environments, and policies are all linked. Knowledge empowers us to make better decisions and inspire those around us. We must demand stricter regulations on the marketing and sale of processed foods, holding companies accountable for their impact on public health. At the same time, we should advocate for increased access to affordable, nutritious options in every community, so that everyone has the opportunity to make healthy choices. We can support policies that promote sustainable practices, reduce pollution, and protect our environment, recognizing that a healthy planet is essential for healthy people. In our own lives, we can make conscious choices to prioritize our health by preparing nutritious meals, staying active, and making time for self-care. We can limit our consumption of processed foods, read labels carefully, and encourage our families to choose wholesome alternatives. By incorporating regular physical activity into our routines, we not only improve our bodies, but also strengthen our communities and support each other's well-being. And let's not forget to prioritize our mental well-being, taking time to connect, reflect, and care for ourselves and those around us. Together, we can build a healthier, more resilient future for all.